These evenings at Unity and Emerald are set for healing and for healing discussions, which is why Annette is here this evening, because her experience is in that world of healing. And quite honestly, our whole existence is healing. Everything we do is that movement back into the oneness and to the source, which is really what healing is all about. And we all have different ways that we recognize that, and different ways that we view it, and different ways that we expand on it and share it with others. To bring us into that space, if you would all just take a breath with me, and we'll get ourselves centered into a space of togetherness as we bring Annette's conversation into focus this evening. And we're going to ask for guidance, that spirit, lovely guidance, the essence of our own intuition, connecting with all that is that directs life. Listening to our inner guidance allows us to be flexible and adaptable no matter the circumstances. And we feel that, and we share it, and we allow it to navigate our shifting landscape, trusting our inner wisdom, helping us forward, understanding endless possibilities. Now take a breath this evening, pause, and center in that awareness, in that space. Allowing for tonight's conversation to open, guide, and move forward your own awareness for your own healing. And so it is. Thank you. I'm going to ask Brian to come up and introduce Annette.
Thank you, Jen. Good evening, everyone. I've had the pleasure of knowing Annette since she was a teenager. And she graduated valedictorian from a high school class, a rather large high school class, went on to The Ohio State University, where she eventually earned a medical degree, became a doctor, and she served as an emergency room doctor and administrator for 20 years. And during that time, she witnessed many things that traditional medicine simply could not explain. And through her observations and through her own experiences, which I'm sure you'll be hearing about tonight, you will discover that the same thing Annette did, that there's something more to medicine than Western medicine. There's something more to healing than what we have been taught in many ways. And so Annette discovered what she calls other modalities of healing. And she came to the point where she realized that she needed to leave for traditional medical practice and move on to these other modalities. So I think what we're going to hear tonight is her experiences with that and sharing her beliefs and her talents. And I'm very excited to welcome Annette to Unity in Edinburgh. And we can't wait to hear everything that she has to tell us. Thank you, Annette.
Right, Annette. I'm going to change the program right over to you.
Okay, thank you so much. Well, first, I want to thank everybody for giving me your time. Time is one of the most valuable assets that we can give anyone. So you giving me time with so many choices out there. I mean, you're inundated with so many classes you can take and programs you can go to, actually can be quite overwhelming. But the fact that you're here tonight pretty much going into it blind. You really didn't know what I would have to offer you. You kind of went on some kind of a gut feeling, some kind of an instinct. And so with that, there's a reason why you're here, and you need to trust that. But you also need to know that you signed up for something that's really quite different from anything you've probably ever attended. You don't see a PowerPoint. You don't see an organization. You didn't see a handout of what the agenda is, because frankly, what you're going to experience on this journey with me, and today you'll hear a little bit more detail as to how we got to this point. But what you're going to see in this journey is that even our language is deficient, and how to learn the world of subtle energies and quantum physics. And the way that you're going to experience this is by listening, interacting, and allowing a whole different type of interaction to occur. So normally you would sit there and you would take notes and try to remember everything I said, but I'm going to ask you, because your time is valuable, that every class that I've ever taught, and Sally over there, bless her, again, attest to this, and she's been with me for 15 years. I want to give you something in this hour that you're giving me your time for, that will change the way you view the world moving forward. So it's not just a class where you learn and have a feel good, but you'll say, oh yeah, we practiced this in this class. And now if I can apply it out there, you're going to see that your life shifts, and it's subtle. We're working with subtle energies here, and you'll see how that occurs. If you give me your presence, being mindful, being here, not worrying about whether you understand everything perfectly, whether I use the right word, if you grab it the right way, but more that you're willing to just kind of feel what's happening here today and creating presence. When you do that, you'll see that your experience of today is entirely different than most classes or lectures that you attend. So let's start with this. Do you remember when you were a kid and you're maybe 4 or 5 years old, and you were so excited because your mom or somebody was taking you to story time? Do you remember those days when you got to do that, or it was your bedtime story? Now, when you expected to do this, what you did innately as a human being, you were excited for the story. You didn't sit back and say, I wonder what the topic is today. I wonder if they're going to talk about Redbird, or the big red truck, or the yellow bird. You just attended the story, and you just were excited to get absorbed in it and to feel it. And you're listening in a capacity, not where you're trying to process it or listen with your ears only, but you're also listening with some other capacity where you're almost taken into a different space, into a different world. And so I ask you, so that this hour becomes more than just hearing my story. As you hear my story, hopefully it'll ignite something in yourselves, that your story possibly even has some overlap with my story. You'll hear lots of little snippets of things that happened over the years. You'll say, oh yeah, something similar to happen to me. So I ask, if you are somebody that's trying to multitask and half listen and half go and do this or half do the dishes, it doesn't really work for learning this work. The only thing that works for learning in this work is that you try this subtle different way of interaction. So when you really listen to someone's story, the way this will transfer out into the world, it's very appropriate that this is December and full moon night. You'll go out into the world, and instead of walking up to somebody at the grocery store and saying, oh, hi, how are you? And you're walking away already. It's going to transfer into, hey, how are you? I'll say, I'm fine. Well, no, how are you really? How are you? And that brief 1-minute interaction with another human being where you really are connecting will create what I call a sacred space. And I learned this very early on in my, if you want to call it a career, where when I interviewed people, it was far more important for me to really listen, really be with somebody, than to take the history and to follow every single thing that I was supposed to ask them. That's where the answers lie. So try this in when you hit story time. Okay. So it's not just about listening to what I have to say, or if it's a good story or a bad story, but it's an exercise in seeing if you can apply yourself in such a way that you feel the story as if you're engrossed in it and see where that experience takes you today. Okay, so today is way more talking, less application, less illustration of all the healing modalities that we will journey through in the next several sessions, because you want to know a little bit about where I've come from. But I encourage you to approach it that way. Okay, so get comfortable, get ready, and we're going to enter story time. Okay, everybody's good with that? Any questions before we begin? Okay, I don't see any. All right, I'm new to Zoom, so I hope I get a sense of interacting more with you towards the end of this particular session. So I'll start by probably telling you just how we got to where we are today. So I began by being an immigrant child. What that means is my parents were off the boat. They arrived here in 1956, 1957. And they journeyed a long time. They didn't have a lot of goods. They were in a new country, new language. And what's typical of immigrant children that is true, even in immigrant children I see today, is that the parents want more than anything for their children to have a better life. And so what they believe is the path to a better life is to study, go to college, make sure that you earn a lot. They never ask you to explore what your passion is or what you really want in life. They never do any of that. They just say, oh no, your studies are important. You need to go to school. You need to do this. And they almost put you on this straight arrow path of where you believe that life is, you know, doing the best you can in high school. Then you have to go to college. Then you have to do this. Then you... And so I was on this somewhat of a treadmill, I would say. And because I thought that's what life was, when I did finally enter medical school, and I'm not even sure that I chose that, that's just where I ended up, I still had this inquisitive, inquiring mind, you know, questioning many things that were being presented to me. From, you know, early on, I remember being a student and I questioned, you know, very simple things is how it began. Well, why do we put these collars on these babies? How does that help the clavicle heal? And they said, well, that's just how it's always been done. No, it doesn't really help. It helps the mom remember not to pick the baby up wrong. And I said, well, the baby's really uncomfortable with that thing on. If it's not really helping the bone grow, why would we do that? You know, and so it began early on that I would question. And so finally, you know, we get into medical school, we keep going. I hear everything was protocols, everything was don't feel, you know, make sure you memorize, make sure when somebody comes in with this complaint, you order this. And so I memorized, I followed the program. And for some reason, I ended up choosing a specialty that was emergency room medicine. I don't know if that was a good or a bad thing, but, you know, we go on the journey that we go on. And as I went through this, I entered a program in Akron General in, what was it, 1986, I believe. It was an all male program. I was the first female to go through that program. And it was tough because they didn't want to date me. They didn't want me to be their buddy either. So I kind of just lived alone, honestly. And, you know, observed more, watched patterns, tried to be like them, but yet I saw a lot of things wrong with the system where, you know, you would, for example, do a procedure and the patient would die and they would just kind of slough it. I don't want to make it sound really brutal, but people kind of slough it under the rug, not make a big deal about it. And I would just feel horrified because I knew that this person would have lived had this procedure not been done. And it was things like that that were jolting me and bothering me. But of course, being a female was a big deal because we weren't supposed to be emotional. We weren't supposed to think that way. And yet, if you're healing people, I started to learn pretty early on, honestly, that it wasn't about the data that I collected from my people, but if I could really connect with somebody, I almost got a sense of what was actually wrong with them. Well, to go fast forward, so we don't dwell too much on that early childhood stuff, though that's what allowed me, I think, to go off this beaten path. I have to show you this. Let's hope we put some humor in. This is what I received when I graduated as the first female from the emergency medicine program. I don't know if you guys can see that. Can you see that? Now, what it reads is, it said, way to hang in there, Annette, EM residency 86, 89. That's a bronze jock strap. That would obviously not be acceptable today, but it showed you the environment. It shows you the environment that I was conditioned in. Okay. So because of all this, I ended up choosing a single coverage emergency room as my first job to get out of residency. And it was at Marymount Hospital in Garfield Heights, Ohio. And what single coverage means is you're not working with any other doctors. I wasn't really part of the whole camaraderie, clan, clique, protocol, program anyway. So what that allowed me to do was experiencing medicine by the book. I mean, clearly I did things by the book, at least initially at first. And then, wanting to set a high bar to be very good at what I do, to make sure that I can be as good or better. Many women went through this back in that day. And so I set a very high bar for that kind of thing. And maybe too high of a bar, because I really, really wanted and expected perfection. And so then what happened is I started to see anomalies. For example, I started to see that somebody would come in to the emergency room and you would check them out and everything was normal. The EKG was normal. The labs were normal. Everything was fine. And still had a kind of a funny feeling that maybe something wasn't fine, but yet all the lab tests, all the protocols following that bump type thing was all good. And so I started bringing that intuitive feeling back again. I remember telling this man before he left, well, your tests are normal. I said, but I still get the feeling that you're not feeling good. He said, well, I'm not. I said, well, would you like to stay? Do you? No. I said, well, you know that you can come back if anything seems wrong and maybe we can rerun some of the tests. This was pretty, my first year I was probably out. And so this man left, and lo and behold, he had a cardiac arrest in the parking lot. And that bothered me tremendously. I thought, okay, so my lab tests, my protocols, the procedures that we were taught and trained to do were done perfectly. Nobody thought anything was done wrong, but that bothered me to my core, that our tests were clearly not as good as we thought they were, okay? There was no indication whatsoever that this kind of thing would happen. Now, the flip side occurred as well, where you would have somebody that had maybe this abnormal, that abnormal, they looked pretty good, and then they would go on and be just fine. It was something they just learned to live with. They had abnormal tests technically, yet, so I started to trust that gut feeling more so that I could be that doctor that didn't, go by the book so much, because I started to realize that gut feeling gave me more than I needed. So there was another woman that came in. I remember she was about 25, 30 years old. And this is where I started to actually put it to the test. I had absolutely no criteria to keep her. All of her tests were normal. And I thought to myself, no, I'm not going to send her home. I can tell something is wrong and I can't prove it just yet. Okay. So I remember getting in the habit, I got to be known in the emergency room as somebody that would keep people sometimes my entire shift, because I wanted to see how things would evolve if I observed and waited for the body to tell me the real story, because clearly the testing and the protocols and all that were not really working correctly for me. So I remember keeping her, and sure enough, she had some very, very rare, fungal infection in her brain that had I sent her home, we probably would have had a very poor outcome. So I started to trust that intuitive thing a bit more. But again, these are my very, very early young days. So where we're headed to now is I want to show you the big things that really led up to why we are here today, where I'm working with subtle energies instead of being in the emergency room. So the next thing that I would say probably occurred is that I had a young woman come in. I was pregnant in the time, so that would have been around 1992, 1991-ish, somewhere in there, but maybe 2 years after I had been out of residency. And she came in, and protocol would be that she came in with pain in her abdomen, I'm not really talking. Her husband was telling me her symptoms, and very, very little could she tell me. She was already kind of not really there. Okay. And so I did my quick assessment, and it was very quick. We're talking minutes here, not many minutes. We're talking 1 or 2 minutes. And I just get this strong feeling it's an ectopic pregnancy. It has to be. It has to be. I just know it. Okay. It's the middle of the night though. And I'm trying to think, how do I prove this? I will not get anybody in. When you're single coverage in an emergency room, you don't get anybody in until, again, procedures have been followed. Every test has been run. Nobody's going to come in the middle of the night to treat anything. And I thought, okay, we did the typical battery of testing that we always do. We got 2 lines started in her. We got everything ready to go. I actually ordered blood before I knew that she had a low blood count. I thought we have to have it ready. The nurses were just looking at me like, really? You don't even know what her hemoglobin is yet. And I said, no, so they trusted that we were following this intuition instinct kind of thing. And so we got all that ready. And after I get all this sent off, I go in to see her, and I see that I'm losing her literally within minutes. And as I'm feeling that I'm losing her, I'm thinking, I can't wait for these test results. So again, I'm not following protocol. Protocol is I wait for the test results, and then you call the appropriate person, and you follow every very systematic approach. Well, what happened is I was panicking from the standpoint that I knew that I couldn't do that time. So I tell the receptionist lady there to, please get the obstetric gynecology doctor online. I will tell them the symptoms. He's got to come in. He's got to come in. We don't have time to wait for the tests. I call him. He said, why are you calling me now? You don't have a pregnancy test back. You don't know this is an ectopic pregnancy. I said, but I think I do. I do know that. And we don't have time to wait for that. And her life is of the essence right now. And he hangs up on me. Oh, crap, what do I do? What do I do? So I go back in. I see that I'm further losing her. We up the fluids. We keep giving her fluid. That's all we had. We didn't have time to get blood. We're down maybe 6 to 10 minutes into the scenario now. Maybe 12 minutes at the most. And I said, call the general surgeon. Call the general surgeon. And they said, seriously? A general surgeon won't come in for an ectopic pregnancy. That's not what they do. I said, just call him. I have to try. So they called the general surgeon, and I was fortunate because the general surgeon that was on call that night was from Armenia or somewhere Middle Eastern, Middle European. He had a little bit darker skin. Honestly, I don't know his nationality, but he wasn't American. That was key. So he wasn't going to follow this typical procedure or follow the program to the letter like any American doctor would, where you have to do that or you're kind of frowned upon, honestly. And so I call him and I say, look, I'm losing her. She's 31 years old. She has 2 other children. You need to come in. I said, if it's not an ectopic pregnancy, you need to see what's going on. We have to try something. I don't have labs back. So he says, I'm on my way. So I knew in these small emergency rooms that are in small towns, most of the surgeons live pretty close to the hospital because they know they have to be called in, and oftentimes is of the essence. So I knew he'd be there, maybe 5-10 minutes. You know, he probably needed to get out of his pajamas and get dressed. So I had maybe a 10-minute window. So I remember going in to, and this is the part that is blurry, but I'm going to tell it to you as best as I can from what I recall. I remember going up to her and holding her hand and kind of being close to her and just feeling such emotion, because here I am pregnant. She has 2 children at home. I wasn't very far along. Nobody really even knew that I was. And I kept thinking, I have to try something. I have to try something, just a few minutes here. And I remember it was more what I was feeling rather than I was saying, but I remember saying and feeling the essence of, use my life force and hang on. The surgeon is on his way. Your children need you. And so I remember feeling as if we were sharing a field or something. I don't know how to describe it, but it felt real to me at the time. It felt like I was sharing my aura or my electromagnetic field with her, at least in the short term. That's how it felt to me. And as I was doing this, the surgeon comes in, they're ready to whisk her off, and she goes up to the operating room. I mean, all this worked like clockwork. And I remember just thinking, it'll be what it'll be. But now I felt I did all I could. But I can't put it into words exactly. And that's why you'll see in this class through the whole 5 sessions that it's difficult to use the human language to fully describe what some of these things are. But I want you to experience them, because as you experience them, you'll know what I mean. It's a universal language of human consciousness. So she gets whisked up to the operating room. And in the meantime, you immediately have to switch gears, because you now have an ear infection coming in and a laceration comes in, and you've got other things to do. You can't even process or really think about what just occurred. And I couldn't. I had other people coming in that needed to be seen. And I kind of tried to block things out again, and we clipped along. And then maybe 2-3 hours later, I want to say, must have been maybe 4 or 5 a.m. I remember I was tired. I was getting ready, looking at my clock when I would be able to get home. Shift change was 7 a.m. We worked 7 a.m. to 7 p.m. in this particular emergency room. And it was probably 5:30 a.m. maybe. And my friend, the general surgeon that had come in, I go, how is she doing? And he looks very distressed. I thought, oh no, what is he going to tell me? And he comes up to me and he literally looks at me. He grabs my arms like this. He grabs my arms. He said, are you? And I didn't tell Brian this because I'm shy about this. I told him the story, but not like this. He grabbed my arms and he said, are you a witch? I said, what do you mean? What do you mean? Am I a witch? Nobody's ever called me that before. And he said, I need to tell you that woman had 5 liters of blood in her abdomen that I measured. And it is not physically possible for her to have remained alive. All she had in her arms and legs was saline. She'd completely 99% bled out. But guess what? She's alive. And yes, you're right. She had an ectopic pregnancy. I said, oh, well, I'm glad you came in. I'm glad you came in. And he said, so am I. He said, but that's not possible. What happened here? That's not possible. And he left. Of course, that made a little buzz in the hospital, what happened in the emergency room. But interestingly enough, people don't like to look at stuff like that. They say, oh, he probably measured wrong. Oh, no, and people move on. I kind of forgot about it. And a few days passed, maybe 3-4 days passed. And so I kept asking, don't forget, she's up on the floor. I kept asking how she maybe is doing. And I had heard that she was getting ready for discharge, and she started asking, when am I on duty? And she wanted to see me. So she came down, she gave me a huge teddy bear with a heart in it. And she said, I wanted to see the blonde lady. You're the blonde lady that I saw that night. And I said, but you weren't able to see me. She says, oh, I saw you from the corner of the room. That was my first encounter with the potential near-death experience. People didn't talk about that then, though. And I just thought, I said, what shirt, what did I have on that night? Do you remember? She was able to tell me what I had on that night. And that's really not possible in the condition that she was in. And so I just thanked her and I said, I'm just glad you're okay. And she left. You don't know what to do with that, because really back in that day, in the early 90s, people did not talk about near-death experience. People did not talk about, and people didn't want to look at anything that deviated from any kind of a protocol. So I moved on, worked a little bit more again. Shortly thereafter, I had to get some, medical credits. So I went to a conference down in Florida and was happy to be there. And I started searching for, and back in the day, they called it complementary alternative medicine, CAM doctor. I thought, I think I might like that, especially I think I'd already had my child by then. And I thought that might be a good thing. At least you could supplement and help people with herbs and other alternative therapies. And so we were exploring that, and that's what the conference was on. And I wasn't exploring the energy world at that point in time yet, but I went down there and I remember kind of walking around again. I was there by myself. Some people travel to these things in groups because they work in practices where they have comrades and stuff. So I was walking around and this kind of gruff surgeon walks up to me that, he's probably in his late 60s. I was in my early 30s. And he's just a conference attendee. I think we were in line for something. And he said, so what are you doing? Oh, you're an emergency room doctor. He says, well, that's unusual that you would be in that field. Back in that day, women didn't do surgery in emergency medicine. They went into pediatrics. So he said, well, that must be different for you. I go, yeah, it's kind of different. And he said, well, can you meet me for lunch? So I'm thinking, why would he want to talk to me? He's a surgeon. I'm an ER doctor. He's 65, whatever. Why would he want to talk to me? I said, well, what do you want to talk about? He said, I want to tell you something. I think you need to know this. I said, all right, I'll say, we'll meet. So we went back into the lecture hall, went back. I remember coming back into the thing. It's kind of a busy place. Those are the, it's a little bit blurry of all the details I had. And we're sitting kind of in the corner of a big cafe type area now. And I'm thinking, okay, that's unusual for somebody like that to seek me out. But I thought maybe he's being nice or felt bad for me because I maybe looked lonely there. Who knows? So he said, I really want to share something with you. He said, so I'm not practicing anymore. I said, oh, well, what did you do, or what brings you to this conference? He said, well, I'm a cardiothoracic surgeon. In fact, he said, I was on the team in 1967 for the first heart transplant in Chicago. And there was a team of about 30. And he said, if you want to look it up, you can. Here's my card. And I did look it up, actually. I thought that was pretty impressive that he would be on that type of a team. And he said, and after that, he said, I had ego larger than life. And what I did is I did thousands and thousands of cabbages. That's coronary artery bypass surgeries. And I enjoyed doing them. I had good success. I had rare complications. I was good, he said. I said, oh, that's wonderful. And so you just chose to retire? Any particular reason? He said, well, I'm getting to that. I said, okay. I said, thanks for sharing that with me. You know, and again, surgeons and surgeons really didn't get along that well because they weren't very nice to me in my residency. And it was that all boys club. It was just tough. So I at the same time, though, I had that instinct always to hear his story, to listen, to see where it goes. It took a lot of trust, honestly, though. So I listened to him tell me this. He said, I'm going to tell you something, honey. I'll call you honey. I said, oh, okay. So he says, honey, let me tell you something. I probably performed 10,000 cabbages. If you figure I did 3 a day, did this for well over 35, 40 years, I performed thousands of them. I said, that's impressive, really. And he said, I'm going to tell you what happened to me. There was a man about 8 years ago, 7 to 8 years ago, that I was operating on, and I never encountered that before. I went in to do the bypass grafts, and that's what they did back in the day. Now they do stents. And when I touched his coronary arteries, they just fell apart like dust. He said, I'd never seen that before. I thought, well, maybe he was too old and maybe there was a reason behind some other condition he may have had that didn't allow me to really correct it. So I closed them up. And again, that was a big deal back in the day because the bypass surgeries are done with full, excisions through the middle of the chest. They get pulled open. I mean, there's a lot of trauma to the body just to get to the arteries that are on the heart. So he is explaining this to me that I felt terrible because I just had to close them up, sew them up. And I'm going to be honest with you, and I didn't know what to say to him. And so I didn't want to blatantly lie. So I just kept the conversation short, and I went up to him and I said, John, I just want you to have a good life. It went fine. We're done with the surgery now. And so he said, great, doc. And honestly, a lot of the surgeons I knew, maybe not true today, but way back then, was pretty typical, honestly. They would send residents, nurses in to do the real talking with people, but they were very short, very curt, very, okay, you're good, we'll see ya. And then they would leave. So that wasn't that unusual. And he said, okay, thank you, doctor. I appreciate it. And of course, I'm sure he told him that when he was half, under morphine or whatever, didn't really pay attention. Maybe his family was there. And he was probably under the assumption that he had been fixed. And so he said, I went about my business and continued to operate and do so many different things. He said, and then one day, about 7 years later, maybe 8, he said, I'm really not sure of the exact time frame, 7 or 8 years. He said, I went out into the waiting room, and there he is saying, oh, hi, doc, look at me. Look how good I've done. You did such a great job fixing me. And when he said to me that day, he said, honey, I canceled my appointments for the rest of the day. I closed my office, never to open it again. And that's the day I knew that all those cabbages I had performed, all those surgeries, that's not how people healed. I said, wow. He said, I'm doing energy work now. I said, what do you mean energy work? He said, well, I'm trying to understand how someone like that can remain alive in my last days. I'm getting too old. But you're young. You need to know that this is true and that this happened. I said, thank you so much for sharing that with me. And I thought about it, and I thought about it, and I thought about it. I started thinking, okay, here I am looking for herbs and for alternative supplements to give people and vitamins. And that's really interesting. Maybe I need to study energy medicine, maybe that's where it's at. And I started thinking, so around 1992, maybe 93, I got my hands on Greg Braden's book that's Walking Between Worlds, and he's talking about love frequency and tapping into the right channel. And, he's kind of a scientific guy for those of you who have ever heard him speak. But I started reading those early on books. He's written 15 books now, but these were one of the first ones in their journey. And Carolyn Mace wrote Anatomy of the Spirit and what she talked about in there. And there's a quote by Hippocrates that says, look not, let me see if I can say it right now, look not at the disease that a person gets, but at the type of person that gets the disease. And so I had to really think about that. And I became, probably at that time, because I was still fairly young, I started to really, really observe. I didn't know if I bought into all this. And so Carolyn's book, she's a PhD, she's not in medicine, but she worked with Norman Shealy, and, they kind of did this together. They called it intuitive medicine. And they started saying that certain qualities in people's character got certain diseases, meaning the chakras were the cause of it. And so I thought, well, we really can't prove this, but let me just kind of file this away. Who gets the kidney disease? Who gets the breast cancer? Who gets the brain tumors? Who gets the, and very early on, they always said the type A's get the heart attacks and the type B's get the cancer. That was kind of a blanket thing that people kind of chuckled about, but she did it detailedly. And if you have any of those books from way back when, you can pull them out and you can read them in detail. I'm not suggesting you do that, but that's the type of thing that I started to pursue. And so with that comes meditation, with that comes yoga. Yoga, if it wasn't really all that popular back then, it was considered, people were just starting to do it and talk about it. And honestly, in our country, a lot of our yoga, and this is not to step on anybody's toes, and if any of your yoga teachers, please don't take this offensively, but a lot of the yoga that's done in the US is a lot of stretching, which there's nothing wrong with that, but it doesn't have that spiritual component and that what it's really supposed to be, where you're going into the spirituality and the aura and all of that. And some classes clearly do have that. But back then, when I went to a few yoga classes, it didn't really make me go, wow. And that's not to say that it's a bad thing. But I dabbled in many of these different things. And I started getting interested in how far we could take this. So my husband had us go to, as a wife, I went as the wife to Palm Springs to an Entrepreneur of the Year event that he had to go to for his company. And they even paid for the spouse to go because it was about client development and whatever. And so I wanted to participate and make it more fun. And I saw the opportunity to take these entrepreneurs. Now, these are very, very successful people as a group, people that have done very, very well, but they're also very left-brain people. And I said to Dave, my husband, I said, do you think that we could maybe do something cool and something new with at least our group that was from the Midwest and see if we could bring some right brain activity? And, to me, it was a testing grounds. Could I teach this type of thing? Would it be received even to a group of people that are clearly very, very intelligent, but maybe a little closed to this kind of thing? And so I talked to the other group leader who was in charge of our Midwest people. He said, you know what? They'll think this is cool because they don't have anything like this. So I'll tell you what, we'll see who signs up for this hike out in Indian Canyon's desert. And if you want to, we'll still get a hiking guide to make sure we don't get lost and that we know what we're doing out there. But if you'd like to do some kind of, whatever you want to do, go for it, And so I thought about it and I viewed this as a great opportunity, great testing grounds for myself to see if this could really have some kind of value. I was a little bit nervous about it because I hadn't ever done this before, particularly with this type of a group. These were not my patients. And so I go to this hike thing and, Dave, my husband, was there. He's online right now. You can see him. And he said, it'll be fine. Just whatever it is, you could always stop it. You can make it long or short or whatever you want to do. And I thought, I think I'm going to be kind of really go out of the box. I think I don't want to just do a little meditation or a little breathing exercise. That just isn't enough. That's not really going to give me enough. And so I did something with them that I was very thinking, how can I do this to see if it really works with that kind of a brain? But I had them, we were walking in a single file line. If you've ever hiked in these canyons, the path to hike is very narrow. It's about this wide. Okay. So we're walking single file, and I got the idea that we were going to feel the person in front of you and see how much information you could get from the person in front of you without talking to them. So I thought, well, they'll think this is weird. I don't know if it'll work. Let me see. And so surprisingly, again, a lot of the subtle energy stuff that we're learning is very innate for you anyway. We were told not to do this way back when we were kids, but we did this as children. And I am here actually to help you remember how to do some of these things again. And so they did it, and they really paid attention. And as we're doing this hike of these men that are very not like this feeling, they're all men by coincidence. There weren't any women entrepreneurs that particular year, though there are many now and many other years, but not that particular year. I remember it was all men. And so we're walking in the single file line when the hiking guide says, "Oh, wow." He said, what's that over there? And we're all looking, and you know, remember, these are canyons. You can see for probably maybe 2-3 miles, you know, everything's just like deserty and hilly, and there's brush everywhere. It's hot, no shade, no trees. And he's looking at it, he said, we go, is it a hot air balloon? You know, we couldn't tell. He says, oh, he said, that's far away. He said, I don't know what that is. Didn't think anything of it. And we keep walking. And people say, oh, look, whatever that thing is way back there. He said, oh, that was miles away. It seems to be following us. So we keep looking. We still really couldn't identify what it is. It looked like a little squiggly, but a balloon movement isn't like a bird or like an animal. And so it really does catch your attention. It's something that doesn't seem to even belong in the canyons. And where would it come from? There are no houses. There's nothing out there. So we're looking and we're watching. And he says, you know, I've been doing this hike, he said, for my entire life, honestly. I have never seen anything out here. And he kept watching it, and we kept on hiking, going on our merry way, doing this and that. And this balloon keeps following us. It's getting closer now. And he says, boy, that is just the strangest thing. He said, what is this? So we continued on. We even stopped to do like a little breath thing, a little meditation thing. And we talked again. And surprisingly, this group got quite a bit of information about doing this. Can I get information from somebody without words? Okay. So you focus in on their body, not their body language, just there's something. Again, we don't really have words in our language to describe what this is, but somehow everybody seemed to understand it good enough where they said, you know, this is really cool, because I think I picked up that this person was feeling this, and then they were able to check it with the person that was in front of them. So I thought it was pretty cool, and I was happy, yay, that they were embracing this and that it was kind of sort of working. And then this balloon gets a little closer and a little closer, and you say, well, what is the big deal with this balloon? Well, guess what? This balloon flew literally into my hand, and I still have it today. You can read that. Hugs and kisses. Now, let me tell you, these entrepreneurs weren't the same after this happened. They said, how is this even possible that a balloon would show up in the middle of the desert and fly miles and fly into your hand? I don't know what that is. I don't know what to make of that. And I kept it, and I still find that very meaningful. That's the universe saying, you've got to do this work. You've got to do this. Here's hugs and kisses for you. Keep going. And so you have things like this happen. Truly, they happen. They happen to everybody if you start to tune in, if you start to pay attention, if you start noticing things like this. So these were the things that kind of got us where we needed to be early on. So then I thought, okay, it must be the energy work that I need to experience, that I need to go for. Of course, the difficulty with working with subtle energies, Reiki and, healing hands and all this kind of thing, the chakras, is you can't study it like you do science. And so there was this feeling, I thought, well, wait, maybe I need to study what the Chinese do, the Qigong and the Tai Chi. Maybe I'll get it better because they have a different language system. They have a meridian system, not a chakra system. And so probably around early 2000, 2002, maybe-ish, 2003, I think, is when I started looking at Chinese medicine, and primarily their martial arts to learn about the human energy field, because I wasn't quite getting it with some of our modalities, like the Reiki. I felt energy flow and all that, but I didn't see the profound effect that I maybe was searching or seeking out or wanting to have. So I met Nan Lu at a conference as well, and he was teaching, and he's from China. He lives in New York now. He's actually pretty well known. He has YouTube, so you certainly can look him up and learn from him as well. He's hard to learn from the standpoint that he's very Chinese and has a very thick accent still. But I like the fact that I felt he was the real deal. The reason he's in the United States is because China said that when people get together and do Qigong, reg meters go off, they have too much power, and so it became forbidden for people to do Qigong in public. And he said, and I knew from my Qigong master, and he's a grand master now, he wasn't at the time I had him here. He came here and he said, I need to put it in a country where people can learn this material. And of course, he was crossing cultures too. So he also saw that American people compared to Chinese people, at least the ones that he spoke of, were too cerebral. And he always said, we need to get out of our heads. We need to think differently in order to allow the energy to flow, which he alluded to the fact that it was more innate for the Chinese people. So anyway, as I was learning all this Chinese stuff, I had another profound experience that I need to share with you before we head into questions. I think people maybe need a little break. But as I was learning about these meridians, a very good friend of mine got a diagnosis, it was called BOOP, which is a very serious lung disease where you you die or you have to get a lung transplant. There's nothing anyone can do. The University of Michigan pretty much told her that she would not live, that they can't give her much except steroids unless she received a lung. And she was probably about 60 at the time, maybe. I guess I'd have to check that again. But she was in her 60s probably. And what she did is she kept calling me and saying, Annette, I'll do anything. I'll do anything. They have nothing for me. All they want to do is give me steroids, and I don't know if I'll get a lung because I'm old. And she was already short of breath, coughing, going through all these things, losing weight. People that have these kind of bronchial or lung problems, they're like the people that you see with COPD, which you can maybe relate to better. They're working to breathe. So I saw the weight loss with her, and I really saw that we were in trouble. And so I said, okay, I'll tell you what, I just started dabbling in this Chinese type thing. You want to do this journey with me? You want to give it a try? I'm certainly not a Chinese doctor. I'm not an expert in it, but I thought that I had enough that I could take her through the journey of another way other than a lung transplant. And so she said, I'll try it, whatever. What do I have to do? I said, well, what you need to do is just work with me. The Chinese people that work with acupuncture and reading, this is the traditional type of Chinese medicine that he was referring to. It's ancient. It's literally thousands of years old. They believe that you get certain conditions based on certain emotions that you've gone through. And the way it was taught to me is that it isn't the emotion the way an American would describe it. So I learned from that any lung condition is grief, but grief, not like, oh, you just sit and cry all day, which she was doing, but more grief like a very painful loss of some kind, feeling that something was taken away from you that you shouldn't have lost. So even if somebody has a loved one die, there may be officially somebody saying, oh, they're grieving over here, but that's not what the Chinese people would say. They would say it's when you feel this utter sadness, devastation that you don't think you can turn over. And then they have these like circles, and we can go into this a little bit more in greater depth, where you can't destroy or create energy, but what you can do is transform it. So what you can take is grief and you can change it over into another type of energy. And that is their belief system. So I took this friend and I said, all right, let's just start from the beginning and let's see where this takes us. She says, okay. I said, you're going to have to be real and raw with me and tell me exactly what you're feeling like to your core. This isn't about us just having a nice little chat together. You have to really give me what's happening inside of you at your core. She said, okay, I'm going to do it. So we sat down and I said, okay, let's start with think of the earliest time that this lung condition began, that you started coughing, little cough, little tiny, okay? Tell me when the beginning of this occurred. She said, oh, I can tell you exactly when it occurred. It occurred and she gave me the beginning of the month in early September. And I said, okay, now I want you to tell me what was happening in your life at that time. I mean, specifically go through every detail. How was your job going and everything? Oh, she goes, I can tell you what happened. My daughter, who I knew of her daughter, they had had a falling out, and her daughter did not want her mom to come to her wedding. She only had the one daughter. So this broke my friend's heart, and she said, oh, that can't be it, but I don't want to tell anybody this. But I went to her funeral, I went to her wedding, and I sat in the back. The Catholic churches, they have the things at the top where the choir sits, so nobody would see that she was attending her daughter's wedding. So she snuck up there. I don't know how she did this. And she sat in the back and watched her only daughter get married without her husband and all of that happening down below. Okay. She says, I could never tell anybody that I did that. You have to keep that a secret. We don't have names here, so that's okay. And I said, okay, well, thank you for telling me that. I said, that must have really hurt. She said it was worse than going to a funeral, because that hurt, that loss, and then she just starts crying. So we have something to work with now, don't we? We have serious grief. The Chinese told me that you get lung disease from grief. But again, it's not that exact same scenario wouldn't be true for all people, just in her, because it hurt her so deeply. So it's the perception of what's happening around you that you have to look at, not the actual event. And that's important to know that. And so we talked through it. And I said, and I explained this to her, and we had probably 2 or 3 weeks of dialogue, because initially, she said, no, my lung disease is separate from this. But we started watching the pattern, when she was worse, when she was better, what was going on inside of her with this. Well, I can only tell you that maybe 4 or 5 months later, when she just one day said, I remember it like it happened yesterday. She says, I will not let my daughter kill me. She said that. I didn't say that. I said, oh, okay. Okay. There you have it. And she is alive and well today without a lung transplant. What happened with her boop that she had, the damage that was in her lungs remained, but it never continued to progress. Now that was big for me because I'd never worked with a disease and emotions on that level. Certainly they do impact people, but not like, wow. So from that point on, that was probably about 15 years ago, I began to really pay attention. I said, there's something to this and I need to get this. I want to keep observing. Okay, so when people are angry, what happens? Anger, I started to observe. This is taught, but it's more. I encourage you to, as we journey through these next couple months, I want you to do the same. You need to experience it. You need to see it yourself. So I started to observe the people that were angry clearly had things going on in their liver and their gallbladder area. You know, and I started thinking back, oh, wait a minute, my grandmother used to always throw up bile after her son visited, and they thought, anger, the release of that. And so I just started to observe. It's not that I had data, but the good news that I had is in those 15 years, as people would come to me, as we would work with all these different modalities, you know, my own path grew. And honestly, the miracles became more and more prevalent. And today, I want to say I live my life, as Einstein said, you either live your life as if nothing is a miracle, or you live your life as if everything is a miracle. And the point of going through this journey, if you're willing to travel this way with me, is that you have to know that it isn't about how well I can articulate something to you. All I can do is share. All I can do is nudge, help you remember as to where you came from. And we can use subtle techniques that may or may not get you there. And I have one before we close and open for questions. I have one more thing I want you to try tonight. It's full moon at 11 o'clock tonight, Eastern time. Lots of people poo-poo that. They say, oh, full moon. Well, sun rises, sun sets, kind of a big impact. We have lightness, we have dark, we have light, we have dark. The full moon isn't too different. If you haven't seen the full moon's impact, go look at some tides in the Bay of Fundy or on Hilton Head. It's phenomenal. You see these large bodies of water being drawn by a tremendous force, and our bodies are 60 to 80% water. So you'll say, well, what do you want me to do? This isn't a note-taking class. Just kind of take a moment before you go to bed tonight and go outside and kind of just be in awe of what it is and what it feels like to you, and feel yourself connect into it. It's subtle. It's subtle. And as you do it, you'll say, wow, you know, it's getting out of your head. In my early days, when Sally first met me, oh my gosh, my standard line was monkey brain, get the brain out of the way, get the brain out of the way. We can't use that. We have to use something else. I don't even know where it's located. Some people say the gut feeling, the heart, you know, it's in the electromagnetic space that we're in. Now, as we move forward, what I do want to know from all of you, I hope at some point we can share some of your stories. I hope you'll have stories to tell and how you interacted differently with people as we go through the holidays, especially when you see somebody that you thought you didn't want to see, and instead of reacting instantly, you're going to look at them and you're going to say, now, how did you come to form that opinion? Especially in these times when we have anxiety, depression, almost a war going out there between everybody. I was talking to somebody this morning, we have a civil war going on. We do. People's opinions. It isn't about agreement, but understanding that they were a baby just like you someday, and all these different experiences made them possibly who they are today. And it isn't about agreeing or reacting, but as you hold that space for someone, that you care, that you allow that love frequency to come into play, okay, that connection with another live human, you may see you're being, you're instead of doing. And as you do that, you'll see some very interesting things happen. And I'm excited for you because it'll change your life. These small things are powerful. So let's open it up for questions because I need some feedback from all of you where you would like to go. I've dabbled in just about everything. I've met Bruce Lipton. I've talked to Greg Braden. I know Lynn McTaggart. It goes on and on, but this isn't about me. This is about me sharing what I can to nudge you where you want to go. And I'm hopefully going to be your facilitator in the next sessions to come so that you give me some direction as to what you would like to see.
Right.
I
You
see
have a
Jen.
question. You have a question here from Synth. So Synth, would you unmute, please?
Hi, Jen, it's Sydney.
Hi. Hi. You got to stay unmuted though.
Thought I did that. Okay. I have I have a question for Annette. She was you were just talking about the Chinese have kind of a different definition of emotion and how it affects us and so forth, and regarding disease. And I just wondered, what do they how do they connect emotion and disorder to like a disability that someone has throughout their life, like from birth or childhood?
It depends on the disability. It's kind of an open, that's a blanket kind of question. If it's something they were born with, like a congenital defect, or that's what you're thinking, or more of a, expand a little bit if you could.
Well, a neurological damage that causes spastic movement and affects my balance.
Okay.
And so, I mean, as a child, it was not that noticeable, but as I've gotten older, it's become more pronounced and more problematic.
Okay.
Just wondered what they would think about that and how they might treat something like that.
The Chinese are very interesting because they view, I'm happy you asked the question because I'd like to expand on it possibly as we move forward into these other days. But to answer it for now in a brief fashion, the big thing that Nan Lu repeatedly said, I even have a t-shirt, maybe I'll wear it next time, that said, everything that happens in life is good, but can you see it? So when he first was teaching this out to us Americans, said, well, what do you mean? How could that be good? But they view everything that is as being okay as it is. And they don't judge it as good or bad, at least in theory. I haven't been to China. I have not met Chinese people. I only know what he is teaching to us. And I can only say that in this sense, it would be, we have these earth vessels. If you look at an earth vessel, your body having spasms, and if you looked at it as, do I have to know the why, or can I take what I have and live in a different way where I can open myself up to a different type of a learning? It's something that you would innately come up with. And I wish I could work with you a little bit on more detail where the spasms won't become something that confines you any longer. It's not about whether, it's not the why or the how, but can I, like, I'll give you an example, maybe on something that's a little clear. I had a number of patients before I did any Chinese thinking, and I really didn't understand this when I was 30 years old, that would tell me cancer was the best thing that happened to me. I said, what do you mean? What do you mean? You know, so it's something that happens inside of you that makes you see that the dis-ease or the condition that you have could potentially be the yin and the yang. They're big on the yin and the yang, your gift as well as your curse. It's like that. So there's not a good description beyond that I can give you. And I'd like to expand on it in other classes. The Chinese comprehension to really understand their model of disease and illness is complex. We would have to spend at least an hour on it, because what you would see is that their definitions are different, their language is different, their exchange is different, their perception of good and bad is different. I mean, it's not something that you can answer simplistically, unfortunately. I'm sorry for that. See if you can find something that your own higher self will say to you. It's probably where I would try to begin.
Yeah, I do understand what you're saying, and I do alternate between feeling like it's okay as it is, and then, you know, the world kind of kicks in and says, you can't do this and you can't do that because, you know, you have limitations and so forth. And so because of the way things are, you know, in our everyday life, and I kind of alternate back and forth between being discouraged by it, and at the same time, I alternate back to saying it's okay as it is.
It's a start. That's a good starting point. But if you look at people that say have a total paralysis, neck down, imagine they're laying in bed, they can't move at all. Okay. I'm not doing a comparison here, but they have to completely rethink their life. I remember a patient in my head specifically that was a diver, and she dived poorly, broke her neck. I mean, her life as a diver now becomes life as a quadriplegic. Okay. Now, what she would tell me is that she had the ability, and these are very special people that were my teachers, I was not their teacher, to tell me, you know, I'm able to live life two different ways. Had this accident not happened, I would not have been experienced life without it being consumed by diving. I had to go within. I had to feel, live. You know, you look at Anne Frank, you know, blind and deaf. She would not have felt as much as she could with her other senses had she not had some of the other things not present. But these are answers that if I were working with you one-on-one, I would want you to find the answers of what this means for your life journey, not coming from me. I would try to nudge, if anything, for your higher self to communicate with you in such a fashion that you would be able to feel at peace relatively with it. Does that make sense?
Yes.
Annette, we have a question on the chat. It says, what emotion is related to a stroke?
Well, stroke is a seventh chakra illness, and I wouldn't even say that it's a specific emotion, but it's a seventh chakra illness. And that seventh chakra area is the conflict with spirituality. And I have to be careful with my words. I want whoever I'm talking to feel more what I'm saying, not listen to my exact language and my words. So if we're looking at the seventh chakra spirituality thing, it's more, again, I'm thinking of people I've known in the past, because I don't have faces to look at. I don't have a sense of who is speaking to me. I'm thinking of a patient that I knew that said, I've been religious my entire life, and I don't know that I know God. I'm very conflicted by this. It troubles me. It weighs me down. And when you feel that closure of a chakra shutting down, that doesn't mean that you caused the stroke. I'm careful with this. Some people, when you start doing this and you read the anatomy of the spirit, you say, oh, I caused it. No, your body possibly is reflecting what's happening on your soul level. Okay. Your soul may be starving, may be hungry. And in the process of having your earth vessel change, your soul is now living in a different vessel. And again, it's more you looking at the greater picture as to what your soul will feel. And my belief system, and I say this as a belief, not a truth, my belief system right now is that our bodies are very, very temporary. We live in this body, but when you can feel in some of the exercises and some of the things that we do, you can feel that it's almost like the easy way I can answer this. Do you talk to yourself? Do you have conversations with yourself? Who are you talking to? You're having a conversation with your earth body and your higher self. It's kind of like, it's a really weird thing when you think about it. And so you want to feel and say, okay, I have this altered earth vessel now that potentially came from some kind of a conflict I had in my crown chakra. So now here I am. Is it good? Is it bad? You think yin yang. And now you say, how can I make my life more enriched having an earth vessel that is potentially this way, not that way? Now, what I did see with stroke people that's been fascinating for me is that visualizations are powerful for them. Example, the woman that had the quadriplegic thing, I remember I didn't directly work with her. This is traditional medicine, actually. They used to tell her to visualize herself doing the activities she loved, and the body started to heal. And real medicine didn't want to look at this. They said that's not possible. She has a severed spine. But the thing is, everything is possible. In the point that you want to say, I almost encourage you who's speaking to me now to read some of the books where people have really done the impossible. And it's not them that did it. They created a space in such a fashion that allowed, I call them almost like portals or sacred spaces where miracles happen. I mean, we read about this in the Bible, people that had cerebral palsy, leprosy, Jesus touched them, they were healed, just like this. I've seen people that had paralysis, and you can try this technique, that technique, and physical therapy, and yet one day they're walking again. I have many, many stories to tell you. And unfortunately, what helps me teach this, because it's so squishy, it's not hard science. It's not a PowerPoint presentation. It's something that you can almost, I hope, just feel in our dialogue, is that there's mystery to it. It's how do you allow the miracle to occur? Yes, you pray. Yes, you do it. But there's so many different ways that people describe all of this. Greg Braden has a whole book on how we should pray, that we don't plead, we just know that it already is. These subtleties. But I almost say, just go to your core, deep down inside of you, and say, what does my body need? What does my soul need that my life is still full and enriched despite what's happening in my earth vessel? And where is it going to go? And you're going to find some of these answers better than talking with me. Maybe at some point we can talk one-on-one and you get nudged into the right direction. That's all I really am, is a catalyst. It's you that have this ability. And it's when you tap into the field, has anyone read Lynn McTaggart that's in the audience? No?
You have several people shaking, yes.
Yes. Well, she talks about the field. Many people out there have, when you're connected and everything feels great, it's expansive, it's consciousness, it's opening yourself up to all of these possibilities. So I hope that's helpful. It's not an answer I am totally satisfied with, but it's a beginning, at least in a group setting. Anyone else have questions? I'd like to see what direction you'd like to go. I know we're out of time. I don't want to run over.
Yeah, we need to start closing out, but I know you're coming back next month. So I'm gonna, everybody that's here, you can go to the same website and click the RSVP so that you get a reminder. Remember, the Zoom information is right in your in the description. So everything's already up for your next visit or visits. Everything's already there, so people can click that. And if you would like, everyone, if you have questions that you would like me to pass on to Annette, or to, while she's thinking about what to do for next time, you can send those questions right through that email and that link that you have right on that site, and we can make sure she gets all of that.
What I would like to do is hear some of your stories. I would love if you really try these small things that we talked about, do them over the next month. And then what I was going to do, unless someone has a different program, is I was going to actually introduce you into, it's called a birthing practice that we do, where it's, it's New Year, but we do with Qigong. And that gets you in tight connection with your higher self and helps you see your soul clear, that type of thing. So I do want to hear from you, though. It's a weird genre for me that I see a few faces. I don't see all of them. And if you could tell Jen, maybe she can email me what people have an interest in, what they want to hear more about, what they have questions on. And if I don't hear from anybody, then I'll kind of roll with it, as I say. But that's how I live my life now. I surrender to rolling with it. Things will unfold as they're meant to, which isn't always comfortable, but that's just how it is. And it's exciting, though. I have to tell you that with all the depression and anxiety that's out there, I want to leave you with one other thought. Curiosity is the antidote to anxiety and depression. We can talk more about that next time, because you'll say, what do you mean? We can give you examples on that.
Great. Thank you so much, Annette, for your time this evening. You have a couple of people in here saying thank you for your answers and for taking their questions. And you have a lot of smiling faces here in the room and a lot of people shaking their heads. So thank you so much for being here this evening. So, and thank you all of you that have joined us and that stayed for the whole time. And I look forward to seeing you again on Annette's program or any of the other ones that are being offered. Thank you so much, Annette. I will check in with you sometime tomorrow, okay?
Okay, and all of you, thank you for giving me your time. And as you go into the holiday season, just look for that silver lining every single day. You'll see things will happen if you pay attention. Okay.
Beautiful. Thank you. Take care.
Yes, thank you. Thank you for your time.